Hello everyone, my name is Dana Giral and the purpose of this presentation is to examine the usefulness of the application called Muscle Trigger Points for nursing professionals. Let's find out more about this application. The Muscle Trigger Point app is available for both iOS and Android users through the phones and tablet devices for only $2.99 without any additional in-app purchases. The Muscle Trigger app is downloadable and it allows users to analyze the source of pain by examining where the pain begins in their common reference points. It also provides information with written text and pictures to over 70 muscle trigger points across the whole body and instructional videos on how to perform proper techniques. This app is run by Real Bodyworks and they offer several other apps about human anatomy, their muscles. They have some quizzes, massage techniques, and also anatomy of the skeletal and organs. The app is based on the research findings of Dr. Travels and Simmons, who identified trigger points as hyperirritable muscular points. This pain creates a dysfunction within the cells, firing pain signals that often refer to other areas in the body. The referred pain has a pattern in 70% of the cases. These trigger points are nodules of muscles, and by massaging them, certain relaxing hormones are released to relieve the pain. The theory behind trigger point therapy is that contracted sarcomeres lead to a decrease of blood supply to the area, causing a metabolic crisis, which then leads to pain. The app is a completely medication-free option for pain management and can be utilized pretty much everywhere. There has been a severe increase of misuse of prescribed pain medications, not only in the US, but unfortunately worldwide, to treat chronic pain. Trigger point therapy is a holistic approach to relieving the tension through a deep tissue massage of those points. The app will help you navigate through the possibilities where the pain can refer to. Other more invasive options to trigger point massage is the injection of normal saline steroids or analgesics to the area, but that rather masks the symptoms than finding the source. The app is very user-friendly with a drop-down menu that categorizes each section, which makes the layout clear and organized. The layout of the home screen, as shown in this slide, is easy to read and navigate, and the colors, formatting, and font of the text and background are easily to read without strain. Being a mobile app, it can be accessible from pretty much any phone or tablet device, and once downloaded, you don't need internet. The app provides information to over 70 trigger points around the body and will help explore with the client where the source of the pain is coming from. The app will show reference points of the pain by listing the most common ones on the top and the least common ones on the bottom. The pictures and videos provided are great to visualize the human anatomy and learn the proper techniques on how to find and where to press to find relief of those points. A great advantage to this app is that it does not require the use of personal health information, and so it does not pose any HIPAA problems. Furthermore, it won't require you to open up an account to share any type of personal information. We must keep in mind that the scope of practice of nurses and realize that we cannot diagnose or prescribe medications. This app can be used as an advice, holistic interventions during hospitalizations, and a reference guide to localized muscles in the body. There are some experts that question the actual benefits of the various types of trigger point therapies, like invasive or non-invasive ones, due to the lack of evidence-based research. Ethically, we need to understand that the patient has anatomy and we need to respect it, because some may dislike the feeling or their pain might get worse. Like any clinical decision support tool, the Muscle Trigger Point app comes with the advantages and disadvantages. It is a reference tool to educate about the human anatomy and explain the source of pain and therefore promote patient comfort. This app is also available for only $2.99 without any additional in-app purchases. Once the application is downloaded, you can access it everywhere. Another benefit is that it has a contact support that can be contacted if you have any issues. This can also be a disadvantage because it takes up to 24 hours for them to respond. While talking about the price, It's not high, but it's also not for free, so some may not download it. That might be the reason it has only 338 ratings so far. But I should mention that it has an average rating of 4.6 stars out of 5. Finally, some patients may just not like the feeling of the treatment and may say their pain gets worse. In conclusion, I feel that this app is very helpful and it will be very useful for nurses and other healthcare providers. Medicine, and especially nursing, is moving more and more towards a holistic approach of patient care. Addiction to pain medication has become a severe and serious issue worldwide. This app provides a solution to the actual source of the pain rather than focusing on covering up the symptoms, and it's only for $2.99. And that's nothing compared to the cost of co-payments and doctor's appointments. Despite all of these great features, nurses should keep in mind that they are not supposed to diagnose or prescribe. Nevertheless, the app can be used as a holistic addition. After playing around with this app on my own time, I can support the use of the Muscle Trigger Point app as a clinical decision support tool for nurses to provide quality care to their patients, families, and even for themselves. Thank you for your time.